Namaskar. My greetings to both Dr. Sunita Tandulwadkar, Fogsi President, and our speaker today, Dr. Gyan Pravah. A very good evening to one and I would like to extend heartiest welcome to the audience of Gyan Pravah, the podcast series. Welcome to episode 125th, hosted by the Clinical Research Committee of Fogsi under the dynamic and very visionary leadership of Dr. Sunita Tandulwadkar, President Fogsi 2025. ज्ञान का बहता रोजाना एक नया अनोखा रंग हर रात 8 बजे जुड़ी फॉक्सी के साथ. I am Professor Dr. Sunita, the Chairperson of Clinical Research Committee of Fogsi and your host for today. It is my privilege to welcome our distinguished guest, Dr. Dinesh Baswar, former Joint Commissioner, Maternal Health, Ministry of Health and Family Welfare, Government of India. Today's discussion is on a topic of immense importance, pioneering quality improvement in childbirth, the LaQshya initiative. Welcome, sir. I would also like to welcome our very own President Fogsi, Dr. Sunita Tandulwadkar, who leads more than 40,000 members of the Federation. An iron-will lady, a visionary and a force of innovation. Dr. Sunita doesn't just lead, she inspires and transforms. With every initiative she takes, she uplifts those around her, empowering them to become leaders in their own right. Her revolutionary Gyan Pravah series is a daily podcast that has completed 124 episodes. Today is the 125th one. And she has turned 30 committee chairs into confident voices, each shaping the future of the project. Various projects like the Eagle Project is a groundbreaking national initiative which trains every gynecologist in endoscopy. Arogya Yoga Yatra, Doti Ke Zindagi Ke, Sampurna, Nirmal Banaras, Anubandh. These are the various trail-raising projects set to revolutionize women's health in the nation. She leads by example. As a globally acclaimed IVF specialist and endoscopic surgeon, she has redefined infertility treatment in India. She has pioneered advancements that once seemed impossible, whether delivering India's first stem cell baby or steering Fogsi, yes, ma'am. And she has leading the cutting edge science. Madam, we welcome you and we request you for the welcome.
Thank you, Surekha. First of all, let me congratulate you to get Dinesh ji on this podcast. It's honor for Fogsi to have him. LaQshya Manyata, everyone knows the initiative with the government and the pioneer, the visionary. You are going to have the discussion with him is going to help each and every Fogsian on the way. Surekha, you are one of my best committee chairperson, most dependable, and always keeping Fogsi at forefront. Many a times as an emergency, I have asked you to go and attend the meeting, and without a single second lost, you said, I will travel down. Surekha, that is what the Fogsi is. And I definitely see your bright future in Fogsi. These podcast series, Dinesh sir, we got in to 30 committee chairperson, thinking that they will become tomorrow. They are the leaders of Fogsi. They should know how to talk, how to take interviews of the leaders, how to set up the dialogues. And with 12 podcasts, they will evolve a lot in the process. But let me tell you, in last 125 podcast, what I observed is, though it was for the chairperson, I evolved as a person. There is so much to learn from each and every one, academic, non-academic fields, nationally or internationally. Even Nitin Gadkari ji were there in our podcast. So I realized that listening to so many leaders, faculty from all the different zones, I as a person, I as a leader got evolved and benefited hugely with these all podcast series. Everyone tried to bring in some novelty, different topic, which will be of a great use to everyone around. this viewership is not necessarily Foxians. We have even the lay people joining it because it's open on all social media. So I suppose the entire country comes to know what is Foxy and how much Foxy work for a maternal and woman health. So thank you so much. It's honor to be on our platform. And our protocol is I join from the viewers link and you both will be there having your dialogue conversation and we all will enjoy it. Thank you so much once again.
Thank you so very much, ma'am. You have been a mentor to me, a great support, and thank you very much for being there for all of us. Let me now introduce to all our guest speaker, Dr. Dinesh Paswal. He is the strategic advisor to IQA, ex-additional commissioner of maternal health with a total 34 years of health experience, including 14 years in public health and maternal health. He is the pioneer in maternal health and held various historic national level programs such as ASHA, the Pradhan Mantri Surakshit Matritva Abhiyan, LaQshya, which is the Labor Room Quality Improvement Initiative, and midwifery. That initiative also Sir has been the pioneer. And he has provided an end-to-end solution in these programs, starting from the conception to the implementation. Sir has been the pioneer. He has delivered various health KPIs, such as the maternal mortality ratio, which decreased from 178 per lakh live births to 113 per lakh live births during his stay. It has been his guidance, his leadership that we have achieved this landmark. He has sanctioned more than 600 MCH wings, that is the maternal child health wings, in various establishments, the public health institutes, established 232 mini-scale labs in ANM GNM schools, 104 state skill labs, sanctioned more than 259 HDUs and obstetric ICUs, more than 2,444 facilities have been state certified and national certification under LaQshya program. So this is a huge work Sir has done. He has also received the Fogsi Award for this initiative of quality improvement and has been selected for John Hopkins Public Health Scholarship. Of course, we all know Sir for your public health initiatives. He has represented India in various international platforms, co-authored research publication in prestigious journals like PMG and PLOS. Welcome, Sir. We are very, very honored to have you on our Fogsi platform.
Thank you. And lovely to hear your extensive CV, sir. Thank you. Glad to meet you and looking forward to see you sometimes in person. Thank you.
Thank you.
Bye.
Let us now begin this engaging discourse with Dr. Dinesh Paswal. Sir, I would like to know what led to the conceptualization of the LaQshya initiative. What specific challenges in maternal and newborn care was it designed to address?
Am I audible?
Yes. Please.
Thank you, Dr. Sunita and Dr. Surekha, for your kind words. Let me tell you about, the background, how we could actually reach and, launch LaQshya, because LaQshya is a quality initiative. And unless, we prepare, do the groundwork and prepare the state facilities at the national level also, NHSRC was supporting us. So it is a very, very extensive work which was done in the background, which culminated to actually, launching this program. So one of the things the listener needs to understand is that the entire framework was established. For example, the national quality assurance standards were, basically, the guidelines were rolled out. The national quality Also regarding some of the patient safety standards, and kayakalp and other things were also were there. We had this training and capacity building initiative. We also had, a 3-day very short course of the intrapartum care for so to improve intrapartum care. That so that focusing entirely on the intrapartum care, so that we could make a dent into the maternal mortality and neonatal mortality. Now, one of the things which need to be understood is that, with this framework, with this type of, and we have extensive, as you have rightly mentioned, we had extensive skill labs establishment also. Of course, SDU, obstetric ICU were also part of it. And when we had done this framework, we actually, there was a Lancet Commission launch at that time that, more people are dying from access is not a problem now. More people are dying from lack of quality of care. And also, our institutional delivery from 2005, it was 38.7 and increased to, 2021. This is an FHS survey, 88.6, right? So close to 90% institutional delivery, but the commensurate decrease in maternal mortality and neonatal mortality was not there. So, and also there was a paper, Lancet paper, which said that, 46% maternal deaths happened during the intrapartum care and 40% stillbirth happened during this period. Also, under 25% mortality happens. So, having said these type of data which coming up, it was an opportune time to launch LaQshya. So, LaQshya was launched in December 2017. And, it was intended, the objective was to that, of course, one of the intention was to decrease the maternal mortality and neonatal mortality and improve the care in intrapartum care, because there the mortality was there. Also positive birth experience, because WHO started saying that it's not only access of care, positive birth experience needs to be had when a woman delivers, she should have a positive birth experience. Also, respectful maternity care and a sort of satisfaction, whenever they actually have the health, whenever they access the healthcare facilities. So these were the, some of the things which led us to conceptualize this, and also, these were the objectives.
Yes, sir. So basically, we are talking of the intrapartum care because the 40% of the maternal mortality is occurring in that period where childbirth is actually taking place. So that is why the LaQshya initiative came into place, where we wanted to infuse quality in the system. The people are coming to deliver in the institute, but they should get a quality of care. That is what LaQshya is all about. And of course, you have also talked about the 4 objectives wherein you are talking of satisfaction of the patient, and you are talking about the respectful care also. So how does all this fit into the larger context of quality improvement in India's public health system? Do you see that with LaQshya, we are getting improvement overall in the public health system?
So actually, this is, what we have to also understand, that many times maternal health is being taken as a standalone program. But, what we have to understand is that if anything gets successful in maternal health, it can be replicated in other systems also, which is doable. So having said that, once you have a successful program running here, similar programs can be run in the other, and you will be surprised to know that when we had launched this, maternal health, child health wings, and we had also, given the, entire specification and also how the layout needs to be there. This actually traveled to other systems also, like psychiatry people also started, taking interest and, establishing their facilities based on, their good practices.
That is great, sir. So maternal health has now inspired other, facilities, other services also are being taken care in the same manner. That is what I get the message. So which facilities and services were targeted under LaQshya? Is it focused only on the labor room and OT, or any other facilities and services were also targeted?
So actually, we have to understand that, the focus in the start was for all government facilities. But, quality does not get restricted to the government. It has to percolate to private sector, to every aspect of in the health care sector. So I think it was starting point was all government medical colleges, all government district hospitals. So we have close to around 350, medical colleges. Also in government medical colleges. Similarly, we have close to around 720 plus 7 plus, district hospitals. And similarly, we have CSCs, which are close to 6,000. So these are the facilities which were targeted. CSC, especially the first referral unit where cesarean section was being done. So these were the facilities which were targeted. And, the intention was that if we are able to, address the high case load facilities, we will be able to make a dent into the, maternal mortality and neonatal mortality.
Yes, sir. So, sir, the labor rooms and the operation theaters, these are very, very important because women are delivering there. The childbirth is actually happening in the labor room. And if the cesarean section is happening, then of course we need to take the woman to the operation theater. So what strategies were used to improve these labor room existing infrastructure, the existing resources, the skills? What strategies were used to improve this?
So, the strategies were that, we, as I enumerated earlier also, some of them were like, we had prepared labor room design, and wherever facilities, wherever there were deliveries were happening, for example, in sub-center, primary health center, CSC, community health, and also district hospital, FRUs, and medical colleges. So everywhere we gave a sort of a design so that, basic amount of structure is there. And, once that basic structure is there, it becomes easier, to actually, provide quality services, right? And, also, as you know, that as I mentioned earlier, that all medical colleges, district hospital, and CSCs were part of it. We also had this high dependency unit and obstetric care ICUs, which were also in this. So layout, design, standardized, and what would be the staffing pattern, and ensuring strict adherence to clinical protocols. That was another area on which we worked. And of course, continued monitoring and mentoring support and, hand-holding was done. Of course, we also had the strategies. One of the cornerstone was regarding the regular MDSR, maternal death surveillance response, also about the C-section audit and referral audit and their linkages. And also what we said to each of the state is that you need to collect the best practices which you have, and you can also, basically disseminate whenever there is any in a yearly forum where when we collect the, these things will be disseminated so that other states can also learn.
Yes, sir. I remember the expert meetings which used to take place when the design of the labor room, the whole structure, the whole revamping of the labor room has taken place in number of medical colleges and districts. I was one of the, assessors to go and see. So the prior to the revamping and post, the whole structure, the infrastructure, the skills, the resources available, the protocol, everything was worked on, and that is how the improvement occurred in the labor room. And all thanks to you, sir. This whole initiative started from the center, and all the states and everybody was involved, with the nodal centers, hand holding, and taking care of the skills and the protocols of the centers which were requiring the certification. So that is how I'm sure the whole system must have been revamped, sir. So would you like to shed some light on how these facilities and the system was overall prepared for LaQshya?
So, as I mentioned earlier, we had this, framework was already there. NHSRC has established, national quality care, national quality standards framework. Also, they had people in the state level, that is state quality assurance. They had one person. Then district quality person was there. Then you have the quality circles, which used to be established at the facility level. So there was an entire structure from top to bottom. Also, we had this national mentoring group for LaQshya, and also state mentoring group for LaQshya, so that we can travel to national mentoring group can travel to different states and give a feedback what is happening, how are they progressing, where are they got stuck, and all those things. And I was constantly on the monitoring that what is happening, because many times we roll the program but we don't monitor it, and the program does not take off aggressively as it should have. So these structures also, we had a number of guidelines, like for example the birth companion guidelines, which were never thought about. And also, people were quite lot of reservation from the healthcare provider side, that how we could introduce a birth companion into the system, where we have never thought of it. Also, various guidelines which were rolled out regarding the HDU, obstetric ICU, and as I mentioned, the staffing pattern, the labor room, how, and we had funded. It was also, in a huge amount of manner, funding was given to each state whenever they used to submit their plan annually. And I used to personally, look at what they are doing. Are they, and also the donors and everybody was on part of it. It is not that, of course, Fogsi as a professional body was always there. Also, the other pediatric bodies were there. Also, we had included the quality assurance people, the donors, NGOs. All people were together in this journey, because, it was a mammoth task, honestly speaking. It's not I think for the first time, a quality program was being started, and it's not easy. And I think I will say that a lot of people were thinking that it will never start, because also, this quality program is very difficult to do if you don't have the, all people. We had also National Quality of Care Network.
Yes.
I had officially made them a partner.
Yes.
Also, AIMS Delhi was also there. So, and AIMS Delhi, with the help of collaboration with WHO, we could hold one workshop for all medical colleges. We invited 4 or 5 people, and they all came here, and, we thoroughly discussed what we are thinking, our planning is there, and what we want to do, make them sensitized about LaQshya and how to go about it, and all those. So, but it's a huge story. But
yes, sir. I remember, sir, I have been fortunate to be part of the National Mentoring Group, as well as I'm the member of the Nationwide Quality of Care Network. So I have myself witnessed all that you have been telling, how the NMG, that is the National Mentoring Group, how they should travel to the place who wants to get the certification. I myself have traveled to Nirupur Hospital. I remember.
no, but
Yes.
Dr. Sureka, Because you have now said that, let me share with you a very interesting insight, because many times people think the government can't do this, government can't do that. I think if you have the right intention, government could do anything. One of the, and here I will try to tell you one thing. So what happened was that, and it's very important to tell that, this incident. What happened was, this is about, traveling to different, by the National Mentoring Group people. Now, as I talked to NHSRC said that these people will have to travel on their own cost and we will reimburse it. I said that this is going to be a flop show then, because who will actually go for national thing and also spend money from his pocket, and this is nobody can do. So what I did was that I took a approval from the higher level that I will actually they will take a permission from me that they are going to travel. They will be the chief, they will be the state guest. The state will actually, treat them as a guest. Also, whatever they do, they will be paid honorary. So, and that was passed.
Yes, sir. Yes, sir.
So for first time in history, I reversed the thing that, you pay, you do first and then, reimbursement will happen. This is nonsense. Nobody does, it's very difficult to do it. And it will take time also. आपने आज पैसा खर्चा किया, आपको 6 महीने बाद मिलेगा.
Yes, sir. And I remember the very beautiful thing was that an honorarium was also given. So some incentive is there, and the transport, everything was very well taken care of, and that's why the National Mentoring Group, and I remember Dr. Vikram Datta, who heads the NQOC, and he was also one of the very driving force, sir, to take those travels and create those, reports, see to it that the action plan was created for that hospital,
Yes.
so the improvement could occur. So all these things, sir, and the point of care, what
Yeah.
can be done so that the quality is to happen. It's small thing. Use of photograph, use of the various the cleaning, the of the labor room, and then the respectful maternity care, so that the attendant should be accompanying the person. So all these initiatives are took place very well, because of course the National Mentoring Group, and as you said, the quality circles at that particular hospital. So I remember that the administrators and all those stakeholders had to be brought on board so that we could move by. So can you share something about these administrators, the district hospital officials, how they were brought on board, and how these all stakeholders came together, and how LaQshya supported the certification as a whole? So I remember that, and I would like you to share about that.
So actually, since it's a government of India program, so I don't want to get into it some of the interesting stories which have happened during, time. But once there is a I remember I had 2 meetings with AIMS, and AIMS was a little initially reluctant to have, and they were taking on their own time. But I said that this is a government of India program. In the second or third meeting, I told them very clearly that this has to, we are launching it. Whether you come or not, it is you decide. So I think one of the things which actually, once there is an ownership by the government, 50% of the job is done. But that's not the only thing. What program officer or program division has to understand is that they have to also drive it. Programs cannot be run on their you can say that they can't be driving on their own. You have to drive them. And so you have to understand that what are the structures which are there, get deeper into it, that what is happening around. Is there any, hand holding to be needed? So we actually simultaneously or concurrently did a lot of things which were necessary to, for example, respectful maternity care was one aspect which people never used to think about. And, as you know, in the government sector, it is a common practice of physical abuse, verbal abuse, and all those things. I don't want to get into it. But a lot of abuse used to happen, and we had to take care because the woman had one of the NGO by the name of Catalyzing for Change. Dr. Prajita is the head of that organization, and I requested her that we need to have a sensitizing workshop regarding this, and they had collected a lot of data on this, that how women are feeling about, and simultaneously we were collecting data also on patient satisfaction, and that was not very encouraging. So we had to really course correct our things, reason being that if public health facilities are to be used for those people who are meant to use it, I think we have to really raise the bar of these facilities, where I am a strong votary of that. If the government intent is clear and definite, we can achieve anything.
Absolutely, sir. I remember going to Varda at the district hospital, and the look is completely changed. People can't believe that this is the same district hospital. The polished tiles, the labor room, the tables, very, it's very important actually that we should focus on this part where the childbirth, and all thanks to you, sir. The lot of money has also been poured in by the government, and of course, as you rightly said, it has to be pushed directly from the center, and of course then the health being the state matter, states also have to collaborate. So the national, the state, the district official all together collaborated, and this was achieved. All thanks to you, sir. Sir, I would like to know what tangible improvements you saw of the LaQshya. You have observed the prior to the LaQshya, the whole system, and the indicators post LaQshya, or LaQshya is still going on, of course. So what did you find, what indicators you find that they have improved so much because of LaQshya?
So I think now I can safely say, because India is now below 97, below 100 now, maternal mortality is there. The neonatal mortality is also 20, in SRS data 2020. So I think we are declining, and but during my time we cannot, because these are output indicators, very difficult. Maternal mortality takes on moreover. Since the MMR takes also time to get. So I think one of the things which we have to rely upon was basically, are we following the clinical protocol? Are we following that? And 2-3 things were very important, which we were monitoring. One was that unnecessary use of oxytocin, which actually people, whenever there is a lady comes in, we start using Syntelsonon and Syntelson drop. Unless there is an indication, we said you don't use it. So second, what we said was that don't give regular episiotomy. First of all, give perineal support. In case it still does not work, only in cases, very less cases you should. And also another thing, because 2017 December this was launched, 2018 midwifery was launched. So we started also, because one of the things which is very important to understand is, and you being a obstetrician and madams also, so you know better than me that lying down position for delivery is not a good position for the woman to deliver. We are squatters, so delivering in a squatting position or delivering in a standing position is better, because it actually gravity also helps. And so we started this basically this type of thing, that you can choose your position if you like. Don't So that was a very revolutionary thing, which during that time, because people started, and some of the obstetricians must be cursing me that what he has started this type of thing. But
In fact, the alternative birthing positions which you are talking of, it is now sort of a natural birthing which we call.
Yeah.
It's now taking a lot of institutes are taking inspiration. I remember in Sevagram we built the water birth, and the thesis was also given to a student so that this whole concept could be built into the minds, because when we were trained as an obstetrician, we were trained differently. But now we know by scientific methods that yes, alternative birthing positions are required, and not that we should be delivering only in the dorsal position. So that concept, all thanks to you again, sir, because I remember prior to that nobody even thought about alternative birthing positions. Now globally people are encouraging, but in India we as an obstetrician used to be taught dorsal position. So now we are having the birthing chair, we are having the water birth, we are having the lateral, the squatting position. All these positions are coming up, and I'm thankful to you, sir, because though we are obstetrician, a public health person like you has given the inspiration for this. So yes, these are the success stories which are coming out from your side. So any particular institute you would like to, as a success story, you would like to share with us, or any improved care outcome which you think is very important to share, if you would like to tell us?
So actually two institution I will like to refer to. One is that Jawaharlal Nehru Medical College, Faligarh, Muslim University. So there Dr. Tamkeen Khan was sharing her sort of how hesitant people were when she started birth companion. People were telling her, madam मत start करो, हो ही नहीं सकता है तो birth companion आप नहीं हम कर पाएंगे. So but she started, and she was sharing her journey, that how it started, and initially people were reluctant, and now everybody is happy that it has started. So this was one incident where being a medical college and high case load facilities, people always think that it's just not possible. The second is, also in your Maharashtra, where, Dr. Srinivas Gadappa, who's now the dean. Earlier, he used to be HOD for the Obs and Gynae in Aurangabad Medical College. They used to conduct 13,000 to 14,000 deliveries in a year, right? And maybe more. So, he told me that, and we had also, some of the thing which he was doing was that, during ANC, he will be playing that soothing music in their wherever their waiting room was there, and also he had pasted number of pictures of alternate birthing position. And he himself said that people used to come to him and they used to ask, can we deliver in that position? He said, yes, it is, I have pasted because of that only. So, another thing which he did was, which I was also, a part of it, and, we had circulated this. Medical college is a high case load facilities, right? Now, what he did was that, and everybody says that, manpower is needed, maybe we have less manpower and all those, everything revolves that, and, we don't agree to it, and, it falls. But for the first time, Dr. Gadappa initiated standardizing protocol. And he said that, sir, if we can do this, we can take care of majority of things, and, if we still need, we can. And I said that, Dr. Gadappa, if you can do this, and if you need further, manpower support, I will be ready to give you. But he could manage it, doing triage and standard treatment protocol, that everybody should do, whether it is, junior resident, senior resident, whoever is on call, he will follow this protocol. If a patient comes like this, and he has to do that. Also, another thing which he did was that, even guards were sensitized for pregnant women so that, RMC is given to each other. So I think one of the things which needs to be understood is that the guards and all the other, supporting staff needs also to be sensitized about the RMC. So these were two very standing, incidents which comes to my mind when people used to share.
Kadapa, I remember, sir, he has also developed the whole guidelines of the RMC and it was published also.
Yes, yes.
I remember the whole book which was published by him, and I'm fortunate that to witness his presentation also on RMC. So really, I congratulate you, sir, for this whole initiative which has taken nationwide. It was there. I remember many facilities have been certified. Not only the government medical colleges, the district facilities have been certified in the LaQshyas. So Fogsi also has taken the collaboration with Government of India, and we now know about the LaQshya Manyata initiative. So would you briefly like to share about LaQshya Manyata and what was this whole collaboration?
So I think one has to understand that, Fogsi is a very valuable partner with us. It has been going on since the rollout of National Rural Health Mission. Fogsi has been a valuable partner. I can tell you that, initially we were struggling with the cesarean section. So we could actually train the MBBS doctors and, MBBS doctor for conducting cesarean section. Also anesthetist. So Fogsi actually developed the curriculum and helped us in that for number of years. I don't know now it is continuing or not, but during my time, it was, thriving quite well. Another program which was successful where, the Fogsi was very instrumental was Pradhan Mantri Surakshit Matritva Abhiyan, where without your support, it could, I think it would not have been successful at all. It is a successful program now, but when I started, nobody was saying that this could actually, start. But, I conceptualized the entire program. I thought that how to go about it, this is a fantastic thought that, voluntary participation by some of the experts can be there, and we can just, it's not the money, it's also recognition, which is important. And, it is history now. And so, Manyata was, we started because we knew that, the quality has not to be restricted only to the government hospitals or facilities. It has to percolate to every nook and corner, to the NGOs, to the, also to the private health facilities. So Manyata was started, and it started in Maharashtra, let me tell you. And it started with Maharashtra, and, at that time, this mark for mother also became a part of it later on. And, since Fogsi was instrumental in it, and, it really started with a lot of promise, and also it now I think it is now a robust program already, and I think you have done a wonderful job in also basically certifying a lot of facilities which are now Manyata.
I must say that I think we must take the name of Dr. Rishikesh Pai, who is the Manyata program, and under his leadership, a lot of certification has occurred not only in Maharashtra, with various other states also. The certification of facilities has occurred because of the whole robust program which Fogsi has taken. Sir, rolling out this whole LaQshya across the country, there must have been a lot of challenges, especially in the low resources settings and high case load settings. So what were these challenges and how you dealt with them?
So as I said, that once you roll out the program, you have to be on it. That means constantly monitoring, because we knew that if we want to take on the medical colleges, and if we can introduce quality in the medical colleges, and I don't know, I was in a very enviable position of and I never used to feel threatened. Whosoever used to do good work, I used to appreciate. We used to have this, WhatsApp group for Lakshya mentors. We had also a group for Lakshya group also, where, people used to tell that how many facilities have been certified. We used to regularly, my AS used to regular, and let me honestly share with you today, since I am out of the government now, not a single time any review had happened in the government. This is unheard of such a program which is such promise, and normally people who think that the quality program, they will need to, and they used to tell me that we will take review it, but that day never came. I did on my own, and my AS used to ask me, "Ki just give me this snapshot of how many facilities they had, state ने कहा है कि करेंगे और कितनी हुई है." बस वो मैं एक वो बना के उनको दे देता था सेक्रेटरी की मीटिंग में, that used to be highlighted कि भाई ये हो रहा है, ये हुआ है नहीं. And I used to, when these state used to come, I used to ask directly to them. For example, Maharashtra, I used to ask them, why are you not certified? You are one of the front runners. Your facilities are excellent. What is the problem? There is the problem, you just let me know. We can have a separate discussion on it, and we can come with solution. So this way I used to push the states, and also tell them. And infrastructure, in terms of infrastructure, we had spent huge amount of money. Also in terms of other things, I said, you tell me who creates problem for you. We will actually go and address that. I can go to the extent. And my access to AS to JS were very, very easy, and with their cooperation we could achieve lot of things.
Absolutely, sir. And the standards were also very high. The benchmark markers, like they used to ask 90% of the
Yes.
So the standard has to be met, and that used to be. I remember the certification used to happen. 90% standards met मिलते हैं तो ही certification होगा, और उसके बावजूद so many medical colleges and districts have been certified. So, sir, I was just talking about this huge program which has occurred, but now sustainability. What are the plans for sustainability, and also are there any plans for scaling this further?
So one of the thing is that sustainability is especially in terms of quality, we have to understand that we have to decode the quality, right? Because whenever people hear about quality, they don't understand. And if you can, I have used the word COPE, COPE.
Yes, sir.
Quality is nothing but COPE. That means client oriented, provider efficient. So if you can demystify quality, and that's one. The second is that sustainability, this quality is not which is something which we can achieve in one go. The problem is that we have to understand that it is an ongoing thing, and the ownership has to be taken by the facility. Unless that is there, that they need to have resources available, they need to have all those things, they need to have the clinical protocols in place, people need to practice it, they need to be sent for training purposes whenever there is a change in leadership or change of staff. So all those things, and facility, unless they own the program, it is not going to be successful and running. And sometimes it will somewhere down the hill they will have this bottlenecks. But regarding the scaling up, LaQshya has been scaled up. There is another program related to which you must be knowing, that basically because the JS informed me when I had left that Dr. Baswal, we have launched another program by the name in child health by the name of Muskan.
Yes.
So this is happens because once the program is successful, newer programs taking the cue from the other, that it has been a successful program, we can also take it forward. So I think that's what has happened.
Yes, sir. So I think now the whole system is now geared up. So we are already, the maternal mortality rate has come below 100, and we are now geared up. We know during your tenure it has come from 178 to 113, and now we are 97. So the whole system has geared up, and now we know what is quality. And as rightly said, the ownership has to be there so that the quality improvement can sustain, sir. So with that, sir, we are finally coming to the end of our podcast, and I would like you to give a message to our healthcare professionals in the labor room today. What is your vision for the quality improvement? Please let us know, and also the message to the healthcare providers.
So to the message to the healthcare provider is that we need to be cognizant that any lady who comes to the health facilities, we have to see that we provide her respectful maternity care, we provide her a birth companion, we provide her a positive birth experience. Unless we do that, we will not be actually successful in just by delivering. And also we have to be updated with our clinical protocol, that we can deliver them, and the entire experience needs to be positive. That is number one. The second is that, in relation to the healthcare provider, I will also say that, healthcare provider has to take care of her or his health. Now, the important thing is that, these are stressful jobs, and, regular or periodic, de-stressing is needed for the healthcare providers. And in terms of message, I think what needs to be understood is that we are on the cusp of India is on the cusp of doing great things. At the moment, we are declining, but as we go down and down, it will be difficult. But my vision is that it is not difficult. If we go the right way, we can achieve maternal mortality and neonatal mortality basically in single digit in another 5 or 10 years. The other is that if we are able to achieve that, also people come to the health facility, the government health facility. As they go to the private health facility, they feel that we are providing quality of care to them. Also, to achieve both of these, we have to understand that we are a very large country. We are the most populous country in the world at the moment. And we have to have maternal child health research centers in all the states, because especially in the large states, we need to have a full-fledged sort of a research center where we do research and try to understand what is the, are we moving in the right direction? Are we, want to take a new initiative, which is important? And also we have to understand that as in Kerala, Tamil Nadu, you can see that people are entering into late age marriages and late childbearing, and we have a lot of comorbid conditions. So how do we tackle them, especially heart problems and other? So I think that will be the key.
Very good, sir. I think that's a great message and a great vision. As I see from your eyes, that we are going to be the Vishwa Guru in maternal health as well, and fulfill the promise of Modi ji. Yes, we will be leading. I think we can be at par with the European countries if we, walk the right path. And as you said, the research is very important. As the chairperson of the Clinical Research Committee of Fogsi, I take this message that yes, maternal health research is the key, and we need to work on it. Especially taking cues from those states which have done better, and go to those states which we need to perform better. So these two can collaborate, and probably we need to work more on the research component, as you rightly pointed out. So thank you very, very much, I think it has been a very, very beautiful discussion for your experience, your inspiration. I think the youngsters in this whole audience will take inspiration from you, how you have driven this whole program and how the outcome, the mothers, the infants, and the children have benefited from the whole program under your guidance. So as we conclude this insightful episode, I would like to extend my gratitude to you, Dr. Dinesh Paswal sir, for sharing your expertise and shedding light on this very critical arena of quality improvement. Thank you so very much, sir, for your dedication in improving the maternal child health care. It is truly inspiring to know this, sir. Thank you so much.
Thank you. Thank you.
A special thanks to Dr. Sunita Tandulwadkar, our President Fogsi, whose visionary leadership has made this platform available to us, transforming discussions into actions and fostering a meaningful change in women's healthcare. To our audience, thank you for tuning in and being part of this journey. Your engagement and commitment to advancing maternal health drives us forward. Stay connected for more thought-provoking discussions in the upcoming episode of Gyan Pravah. Until next time, let's continue to learn, share, and empower. Good evening and take care. I, Dr. Surekha Daire, would like to sign off. Namaskar.